Medicine, and I'm here to keep you up to date on the latest information pertaining to your health and well-being. Welcome to DocTalk Radio. Joe, how are you today?
I'm good. How are you, Dr. Borik?
Good, good. Sponsored by Gilbert Hospital and Florence Hospital at Anthem. Today we have a fantastic show in store. We have Dr. Clint Leonard, who is an obstetrician gynecologist, in the studio with us. Dr. Leonard, thank you for being here.
Oh, you're welcome. Thank you for having me. I'm glad to be a part of your show.
Awesome. You know, tell us a little bit about your background. I'm just interested to hear about yourself.
Sure. I grew up in Kansas and then came to Arizona for my residency training, and then started a practice about 7 years ago in Gilbert, dedicated to women's health, obstetrics and gynecology, infertility treatments, and just been having a great time doing that.
Wow. You've been here for 7 years already.
Yes.
Wow. That's great. You know, I know you have a unique approach, and I want to kind of get into that and really talk about your approach to women's health, natural family planning, and so forth. Why don't you give us a little insight about that?
Sure. I think for a lot of women, if they bring a problem to their gynecologist, the knee-jerk reaction a lot of times is just a prescription for the pill. Right. Or if they're already on the pill, to switch to a different one. But in my office, I listen to the problem and the issue that the patient brings to me and try to figure out what are the underlying causes, what's really going on, and then address and treat those problems rather than covering up a symptom. Because I think that's the best way to restore a woman to her proper health, or to the best way that she wants to be.
Absolutely. You know, I've read that, you know, birth control pills sometimes can be detrimental to a woman's health. You know, and I don't know, this is an opportunity that I want to ask you. You know, is it true that there may be some carcinogenic, you know, kind of stuff that we can see from the pill, or how?
Sure. Yes, actually, and a lot of people may not be aware of this, but the World Health Organization declared that the hormones that are in the birth control pill are actually a class 1 carcinogen.
Really?
Yes. A few years ago, when the women's health study was done, which looked at hormone replacement therapy for menopausal women, they found that those hormones caused an increase in the risk of breast cancer in women and heart attacks and strokes. Well, the thing is, those same hormones, actually much stronger versions of those same hormones, are the hormones that are found in the birth control pills.
Interesting.
So in younger women, they also are linked to an increase in the risk of breast cancer.
That's interesting. So, you know, the natural approach is really what you have developed your practice on.
Yes.
And so, you know, and so if somebody comes in, what is your approach? Can you talk a little bit about maybe the technology of
Sure.
what you do?
Yeah, one of the things that you mentioned was natural family planning.
Right.
So if a patient's coming in and they are interested in family planning, if they don't want to become pregnant for some time, what we do is we teach them how to recognize their signs and symptoms of fertility in their own body on a daily basis, and then they can use that information to avoid pregnancy. And then if sometime later they want to actually get pregnant, they use the same information, the same tools that we've given them to do that.
Very good.
But it's not just about family planning, it's also about their reproductive health and women getting to know more about their own fertility. So if a woman comes to me and she has irregular cycles, maybe she used to have a period every month and now it's every 2 months and she has some irregular bleeding, either myself or someone in my practice can teach them how to track their cycles, keep track of that information, and then we have a tool that will help us to figure out what's going on and hopefully to, you know, restore her to her good health.
Boy, that's, you know, when you really think about it, that's the ideal way to approach medicine, to deliver medicine, to really become part of the process of health within your own body.
Absolutely. And in medicine, we sometimes we get away from treating the person who's sitting right in front of us and what's going on with them.
Exactly.
You know, it's easier just to write a prescription and send them on the way. It's a lot harder, takes more time to figure out who this person is, what's going on with them, and then find good solutions for them.
That's very, very interesting. I want to tell our callers out there that you know, you're welcome to call in. Dr. Leonard is going to answer any questions that you call in. 480-745-1033. Do you have a question already, Joe? Or
If you hear that,
okay,
that means that there's a call waiting for you.
Okay.
So at any time,
Okay.
whenever you're ready.
Okay.
Our first call, Jan Levy from Portland, Oregon, says, I get the birth control shot. I have a lot of spotting and still get a very heavy period. Is this normal? It's uncomfortable. Should I be changing to something else?
Yes, thank you for your question. The birth control shot is actually a really strong hormone, and it's designed to last for a long time in your body, to have a long-lasting contraceptive effect. There's a couple of really serious side effects from this. Probably the most serious thing is the amount of bone loss that it causes, or the loss of calcium from your bones. So when used over a long period of time, like more than a year or two, it can actually lead to osteoporosis. And for young women, you want to be building calcium in your bones, not losing it. And it may not have much of an effect on you today, but 20 years from now, it'll have a real effect. It will also cause, as the caller mentioned, some irregular bleeding because it really thins out the lining of the uterus. And the lining of the uterus needs some estrogen support to keep it from bleeding. And the contraceptive shot actually gives a high dose of hormones, and that thins the lining, and then you have breakthrough irregular bleeding that's hard to control. So really for my patients who are interested in delaying childbirth, I recommend teaching the natural family planning and actually putting that into use. It does take more work than just getting a shot every month or every 3 months, but long term, the health benefits and the relationship benefits are significant.
Really, I mean, so just the bone loss itself, I mean, that's huge. You know, when you look at osteoporosis as we get older, you know, that's a big thing. Do you recommend calcium supplements for people that are on that, for example?
Calcium supplements are a good idea, yes. It's usually recommended between, for reproductive age women, 1,200 to 1,500 milligrams a day, either in their diet or in some form of supplement.
Right.
It's also really beneficial for about 30 minutes of weight-bearing exercise 3 or 4 times a week.
Exactly.
And that's the best thing that they can do. Not only will help with their bone health, but also their heart health too.
Right, and we recommend that just in general. So the natural process, you know, in a female's body in bone loss is to prevent that. But when you add on top of that the high dose of estrogen, you know, you're getting behind the 8 ball that you might not be able to recover from.
Yes.
So really the ideal thing is to avoid that.
Right, the progesterone, yes. Estrogen actually helps hold on to the calcium in the bones, but it's the
progesterone.
The medroxyprogesterone in the shot that's referring to.
Interesting.
Yeah.
Joe, you have another question there.
Yes, Beth Monroe from Little Rock. I am still on the Norplant system, having it removed to start a family. How long should it take, and how long should we wait to try 35-year-old female?
Upon removing a Norplant delivery system from your body, it may take a few months before your cycles become normal. And cycles being normal are a result of the ovaries working the way they're designed to. And that means ovulating, releasing an egg, and then producing enough estrogen and progesterone to support a newly conceived embryo at that point. So usually a woman's body responds pretty quickly once the Norplant has been removed, but it may take 3 or even up to 6 cycles before they're fully back to normal.
That's a good question. You know, there's physical benefits to the natural family planning technology. Do you want to kind of go over some of the physiology of it?
Sure. For a woman who's using natural family planning and who's in tune with her body, she may pick up something that's going on a lot sooner. Some women, they've had an abnormal discharge, and because they were paying attention to it every day, they knew when it changed and that something was different, and then later were able to find out, you know, that maybe they had cervical or endometrial cancer, you know, and get that taken care of. The benefits of it is that there are not any side effects. You don't have... So if we talk about contraceptives, if you're doing something to the body that's keeping it from functioning the way it's supposed to, there's going to be side effects.
Right.
As a physician, I want to maintain my patient's health or promote it the way that it's supposed to be, which is why I don't prescribe contraceptives in my practice. If the body's functioning normally and a woman's fertility is working good, I want to preserve that.
Very good.
Okay? Contraceptives are naturally going to work against that. Essentially, it's taking a high dose of hormone to shut down the woman's reproductive health system, and that has consequences. So if we're talking about the birth control pill, for example, which has higher doses and really strong estrogen and then a strong progesterone component, it's actually shutting her ovaries down, which are going to have effects on her body.
At some point, absolutely. You know, the whole axis, the hormonal axis within the body, it shows up somewhere. And like you said, breast cancer and some of those things can, can occur.
And also can cause a risk in the increase of blood clots in the legs or even a pulmonary embolus. You know, because you've worked with emergency medicine field, if you see a young woman in her 20s come in, has a stroke or heart attack or something, the first thing you think of, was this woman on the pill?
Right.
Because that's a serious side effect. It's not very common, it's rare, but it is serious and it's very real.
You know, I didn't think it was, I mean, we see that. It's amazing how often, as a hospitalist, we see that. So that is another thing for our listeners to just be aware of. And then when you add smoking on top of that, boy, that just really compounds the risk. I know that the phones are just ringing off the hook, so we're going to get to some of the questions. But I want to ask you, endometriosis, it's a big buzzword. In just a few minutes, can you give us a little information about what it is, how to treat it, how you treat it?
Absolutely. Endometriosis is when tissue similar to the lining of the uterus. The lining of the uterus is called the endometrium. So endometriosis gets its name based on the endometrium. Tissue similar to the endometrium is growing outside the uterus, either on the tubes or the ovaries, in front of the uterus or on the bladder. And that tissue responds in the same way that the endometrium does every cycle. So just as the endometrium gets thicker and grows and then sloughs off, those tissue implants are responding the same way.
Right.
For a woman with endometriosis, that means she gets really painful periods and can have a lot of other effects too, maybe difficulty getting pregnant.
Right.
Okay, endometriosis is a great example. A woman goes to her gynecologist and says, I have these really painful periods. The first thing that's usually done is they're put on the pill. Studies have shown that women who have been on the pill for 10 years or more are more likely, if they're found to have endometriosis, to have deep nodules and deep implants. Those are the kind that are really hard to treat. Those are the kind that cause the most problems. The estrogen in the pill can actually make that endometriosis work, even though it may be helping to decrease their pain while they're on it, it may be actually making it worse.
Interesting.
So in my office, if we have some suspicion that the woman may have endometriosis, the first thing we want to do is diagnose it. And the way to diagnose endometriosis is actually doing a laparoscopy. We actually look inside the belly and look inside the pelvis at our organs to see if there's endometriosis there.
It's visible, right?
It's visible, yes. And then if you can see it, then you can also remove it, and that's the treatment. The most effective treatment for endometriosis is actually removing it. But you want to make sure that you have it first and not just take a pill for something that you may or may not have. You want to make sure what you're treating.
Exactly. That's interesting. You have a question, Joe?
We've got a couple of them here. Maybe I can shoot two to you, then take a break and kind of give them to you here and there. Carmen from New Jersey, and I believe I heard her correctly. What is the naturo-based technology, and how would it differ from other treatments in treating fertility?
Okay. I think she's referring to NAPRO technology.
NAPRO, gotcha.
Yes. NAPRO technology is referring to natural procreative technology. And what that refers to is basically the approach that we've been talking about, Ann. It's identifying the root causes of infertility or women's health problems, identifying the root causes, and then using methods that cooperate with a woman's body and help restore her to her health. It's different than just overtaking her body or covering it up with a pill. Instead, it's getting at the root causes and actually treating the causes that are present.
Let me ask you, what are some of those causes? I mean, is stress, or like what when is it an anatomical cause? Is it a more of a psychological?
It can be a wide variety, and that all plays into it. I think stress is an important part, but it's usually on top of something else that is already there.
Okay.
One thing we see a lot of is polycystic ovarian syndrome.
Okay.
And what are some causes of polycystic ovarian syndrome, or PCOS? Would be maybe not eating healthy enough, or not eating the right foods. Exercise is a way to help improve the body's functioning in those ways. So PCOS is one thing that we see a lot of, and with our diets, they tend to be higher carbohydrates or higher fat diets. We want to get away from that and get people to eating more healthy, and that's a way they can take over their own health and really see some improvements.
It's amazing what happens in the body when you do that. You know, we talk about that often. Last week we had a psychologist on the show, and we were talking about the recipe for health and wellness, and obviously eating right and exercise. But when you really think about it, it affects every part of our body. And so what you're telling me is that infertility and the whole treatment really stems back to aligning, you know, that from that perspective.
Absolutely. And then you're talking more about a holistic
approach. Yeah, instead of putting poison and carcinogens and, you know, all that kind of stuff into the body.
Yeah.
Excellent. What question?
2 calls that came in very similar. Tara, 18 from New Mexico, and Raina, 19, right here in Gilbert. What do I do to get on birth control? And this was from Raina, but like I said, they were similar. I can't see my family physician. I've been going to him since I was 8 years old, and I'm absolutely not comfortable. Where do I even start? And what should I expect when I go somewhere?
Yeah.
And is your practice local then, or?
Yeah. My office is in Gilbert. It's on near the corner of Pecos and Lindsay. Any age really, when you're starting to think about when a woman starts having a period, we usually actually recommend, for example, pap smears start at age 21 or 3 years after becoming sexually active is when we recommend a first visit. But for a young woman who's thinking of being sexually active, it's a good idea to come get an exam, or even without the exam, just to talk to your provider. And if those 2 young women would come into my office, the discussion might be a little bit different. I would want to know, well, why do you want to be on the pill? What are the reasons? And the obvious answer might be, well, I don't want to get pregnant. And then we would go into some sort of discussion about, well, what's a deeper discussion of what sex is about, and if that's really all that it means. Being on the pill is avoiding getting pregnant. There's a lot more to sex and to intercourse than just the effects of not getting pregnant. It's not just the body that's getting involved, it's also the soul. And it's not just, your body that you're preventing from getting pregnant, but it's your heart that's getting involved too. And a lot of young women who get involved sexually at an early age, they're getting their hearts broken, and they're developing bad habits that are going to make it harder for them to have good, successful relationships and marriages in the future. So when those young women would come to my office, those are the kinds of things that we would talk about.
We need to get you on national TV. I mean, that's fantastic, and I think that's a great approach. Any other, Joe, he's getting another question there. Let's talk a little bit about some of the alternatives to estrogen. Are there natural kind of supplements that are out there?
There are some natural supplements. Soy-based supplements have been more popular. Some of the drawbacks, or maybe a negative side to those, is maybe they haven't been studied as well as estrogen.
Okay.
Estrogen definitely has the negative effects of breast cancer and blood clots, but they have been studied the most extensively. Soy-based things are one part of it. Exercise, which we talked about earlier, can definitely help getting adequate sleep. Those are other good things to do. Sometimes calcium or magnesium can play some role in supplements like that. And there are some medications that we can use that can help prevent some of the hot flashes and effects like that don't involve hormones,
right, that's
which
what
can
I was
be
going to ask you.
effective too.
For example,
some of the generic names like fluoxetine, for example, it actually has some effects on the body's ability to maintain its own temperature. Right. And so for a woman who's taking that can help regulate or prevent getting the hot
flashes.
And another class might be like there's a type of a blood pressure medication that can also help.
Like Catapress, or is that something? Or
Clonidine.
Clonidine.
Yes.
Yeah, it's the same. And that seems to work pretty well. in our population. So I guess the message is the vasomotor symptoms that we see can be treated really without using estrogen. And I think that's huge for people that have a family history of breast cancer, that have breast cancer, that really are not going to be using estrogen.
Right.
And
there are alternatives out there. And I think that's an important point from today's discussion, too, is that there are alternatives, and you don't necessarily have to accept the first thing that's offered to you, because there are other ways of approaching things.
Right. I think that is a message that really should be extended loud and clear from the show. Joe, another question.
Leo, 25, is calling in. He has a concern. His wife is 3.5 months pregnant, and he is noticing she is getting brown, noticeable spots, and he's very concerned. Should she see a physician immediately? Could something be going wrong?
In general, getting brown spots on the skin can be a part of being pregnant. The broader category is called melasma, but it's a skin condition. In women with darker toned skin, it tends to be a little bit more common, but does tend to show up in pregnant women, and does not indicate that something is going wrong. It's more just a normal side effect of being pregnant. A woman who may be noticing this starting to start, you might want to avoid the sun, or wear a hat, use an umbrella, something to keep yourself in the shade to help prevent that from coming on so strongly.
Okay, so that's good news. That's just a normal. You talked about when the pap smear should be initiated, early on initially. As we get older into, elderly population, is there an age where you stop recommending the pap smear?
Not that I would recommend stopping the pap smear, but there are new recommendations this year which are different. I think women for a long time have been told to get your pap smear every year. Well, if we look at it in a broader sense, we still recommend seeing your physician every year for an exam and the discussion of general health topics. But the pap smear itself, I said start at age 21. Well, it's actually, as long as it's negative and there aren't other things going on, it's every 3 years to the age of 30. And then at the age of 30, we add an additional test. It's called the HPV test, or the human papillomavirus. If the pap smear is done with the HPV test and they are both negative, that test is good for 5 years. So then a woman's next pap smear would be in 5 years. So, and then it would be every 5 years for as long as they're well and healthy and doing okay. So that's a new recommendation of this past year. And the reason the recommendation came out is because we found out that cervical cancer is very slow to develop. It's caused 99.9% of the time by HPV, or the human papillomavirus, which is a certain cancer-causing virus. But it's very slow developing, and a lot of times younger women may get an infection with it, but their body may even be able to clear it. Now, not all the time, and they still need surveillance and to be looked after, but more and more, I would say, as physicians, we're giving their bodies a chance to heal itself and to get better itself without doing invasive procedures.
Interesting. Now, do you recommend the vaccine?
I don't routinely recommend the vaccine. It is a good vaccine, and it does do what it says. It will prevent a woman from getting more abnormal pap smears and can prevent cervical cancer. I think as a rule, though, the better way for a woman to prevent herself from getting the HPV infection is to limit her partners. If she delays intercourse until she's married, for example, that's one great way, sure way, to help prevent that. As long as a woman is still getting her yearly or every 3 or every 5 year pap smear, she's still going to be in a good state to avoid getting it. On a personal level, it is good. On a population level, I think it's very expensive, and we're talking about health care, and I'm not sure that it's quite as good as some people would say that it is on that side of things.
Right. So really, approaching the individual patient and what their risk is and what their behavior is, and really treating them individually. Yeah.
Yes.
Okay, that's good. I know there's a couple other questions coming up. In terms of irregular periods, I want to get to that. I know that we talked, but I think there's a question. Let's see. Joe, do you have a comment or a question there?
Yes, we've got a couple here. Clarissa from Phoenix had a PAP about a week ago. It was negative. Now I'm getting bad pelvic pains, and I've never had this happen. I'm getting a lot of cramping, too. Maybe this is a coincidence, but when I called the The nurse told me this was normal, not to worry about it. That made me feel uncomfortable. What should I do?
I want to just make sure that we say that DocTalk Radio, is a general show. We don't make diagnoses, nor do we treat over the phone or over the TV. So in general, we can talk about that. But I don't know if you want to respond.
Yeah, in general, a Pap smear by itself or having a pelvic exam shouldn't lead to an increase in pelvic pain. So it's quite possible that something else might be going on, and it would be worth following up with your physician and maybe even going in for an additional visit to see what's going on.
Mm-hmm. It's not uncommon to have some spotting or bleeding after a Pap.
Correct.
Mm-hmm. Okay.
And Jenny from Anchorage would like to know, is there a way I can tell if I have HPV? I have burning urination. Is there any way I can tell physically?
In general, physically, a woman can't tell if she has HPV or not. If she happens to have genital warts, for example, on the outside, like on her labia, and she notices those warts are caused by HPV, but that's a different kind of HPV than what causes cancer. In general, the physical symptom of burning with urination is not linked to an HPV infection. So there might be something else going on, and again, it'd be worth seeing your healthcare provider for that.
Okay, so it's not like you get fevers or chills or, a viral syndrome or anything like that?
Not at all. You can be carrying it and have no idea that you have it. And men, additionally, they may be carriers of it without knowing it as well.
Mm-hmm. Speaking of men, do you ever bring, a patient's spouse in, if you're really, implementing the natural family planning process? Is that part of the approach?
Yes, definitely, a lot of times. And in fact, I would say more than half of the time when we're dealing with patients who have issues going on, a lot of it has to do with infertility, because it only becomes a problem once they realize that they're not able to get pregnant. And that involves achieving a pregnancy involves the husband and the wife both. It takes both people, and so usually, or a lot of times, both of them do come in. It's an interesting phenomenon because a lot of women think that they can go on the pill and avoid pregnancy for a long time, and then whenever they want, stop taking the pill and then get pregnant immediately. But there's a lot of things that go on during those years when they're on the pill that actually can make it more difficult to get pregnant later on. Mm-hmm. First thing is, if they've delayed childbearing and they're older, that makes it harder to get pregnant. Mm-hmm. The pill itself can have effects on the pituitary gland, on the ovaries, and on the uterine lining that can later make it more difficult to get pregnant. Just recently, they've shown that women who've been on the pill for a long period of time, the lining of the uterus, the structure of it has changed, which makes it more difficult for them to get pregnant in the future. And it's changed it to such a degree that it can't completely be fixed in the future. And then probably the third additional way that it can affect your future fertility is one of the leading researchers on the cervix, which is the part which kind of helps the sperm get up to the uterus and to the egg for conception, that being on the pill, for every year a woman is on the pill, it ages her cervix 2 years, which means that it doesn't make the good, healthy mucus that's needed to help achieve a pregnancy.
That's interesting.
So I know I got off a little bit from your question, but
there's some nutritional things, and it's interesting. There's some research that that I'm kind of in tune with, especially now on the DocTalk radio. And recently, a study came out, and you may be aware of it, that walnuts, interestingly, 2 handfuls of walnuts have been found to actually make a man's sperm more robust and healthy. Is there anything that women can do on the flip side of that can maybe make the egg healthier, or
Yeah. We usually give a little handout to our patients, and I'm not going to remember all the things that we talk about, but one example would be dairy products.
Okay.
For better fertility in general, 1 serving of whole-fat dairy a day is good.
Okay.
3 or 4 servings of low-fat dairy, like skim milk or low-fat yogurt, actually works against them.
Interesting.
Is one example. Getting more of your protein from vegetables, such as broccoli or beans, is better than getting your protein from meats. So those are a couple of things that can help in general. It's going to help a woman to ovulate better and to increase her chances of being able to get pregnant. But even if they're not considering being pregnant, but just to have more normal cycles.
Right.
Yes.
Right. Very good.
Francine from West Virginia. I recently had Recently have started getting painful pimples on my private area, 3 or 4 at a time. They come to a white head and there is pus. I'm scared. I've had the same partner for 14 years. What should I be concerned about?
Again, without getting into specifics for a certain patient, that can very easily be explained by something that has nothing to do with anything that might be sexually transmitted. Okay, that's something that you may be colonized, or on your skin there may be a kind of bacteria that is disposing you to that. There's not a specific test for it, but you can get treatment for the ones that you do have now, and then there are a couple of things that you could do to help prevent that from coming back. But from your initial description, I don't think it's anything that would make me think that your partner was in any way responsible for you getting those sores.
She wanted to know because she said they weren't ultra terrible. She wanted to know, should she get this looked at or wait a while and see if they get worse?
That's more up to her and her comfort level. So if they're really bothering her or making her worried, it's best to have somebody else look at them to give their opinion too.
Yeah, and that's what we would recommend. Certainly, sometimes a pimple can get infected. And so if it changes, if it becomes more fluctuant or larger, fluid-filled, it could just be an infected pimple that can turn into an abscess that may need to be drained. So I think that would be the reason to maybe get it looked at.
Yes.
Mm-hmm. The other thing, just one thing, sitting in hot tubs, for example, can sometimes bring that on. So just be careful of that kind of activity. Just going swimming in a general community pool or a hot tub can bring infection and bacteria and that kind of stuff.
Maria Rodriguez from Mesa had gonorrhea 10 years ago when I was in the military. Lately, I've been feeling and seeing the same type of symptoms. Is this a reoccurring thing that could pop back out for no apparent reason because it's still in your body, or?
Typically, if she hasn't had symptoms for that many years, I would be inclined to think that it was something new that was appearing. So again, I think it would be worthwhile getting checked out. Back on your other thing, for pimples or for possible getting infections, it's always important to wear loose-fitting clothing, cotton clothing, not sitting in hot, cramped places for too long of a time, too. Mm-hmm. Those are things that can help as well.
Right. So that's good information. But, let's kind of talk a little bit about irregular periods, because I think that's a big topic. And I know that your approach from a natural perspective. When somebody comes in and says, "You know what, my periods are irregular," how do you approach that?
First, to just ask general questions. What do they mean by irregular? How often are they happening? Which typically we're talking, women will be, when they say their cycles are irregular, they're having bleeding that they're not expecting. Mm-hmm. Like maybe they have a time of the month when they usually expect to get their period, but it's not happening that way, or it's coming a lot sooner than they're used to, or maybe their bleeding's going on every day. One thing that I think, as a physician, in the way I look at things, the bleeding is a sign of something else that's going on. So bleeding for a woman, usually, if there's not something more serious going on, is a result of the hormones that are produced by the ovaries. Mm-hmm. So if she's having irregular cycles, a lot of times we're thinking there's something irregular going on with her ovaries, or her ovaries aren't working the way they should. Mm-hmm. And so then we direct our attention to, why aren't her ovaries working the way that we think they should?
So when that becomes physiologic is maybe a time when somebody's maybe perimenopausal, when they're approaching, 48, 49. Would that be accurate in saying that?
Absolutely. Mm-hmm. That's a very common time. So the average age of menopause in the United States is 51.
Okay.
So it may occur a few years before or a few years after the age of 51. Mm-hmm. And what we mean when we say menopause is not having had a period for an entire year.
Okay.
With the thought that if it's been an entire year without a period and you're around the age of 50 or 51, that you're not going to be getting your period anymore at all. What happens leading up to that, in general, again, for each specific woman, this is going to be different. But in general, a woman's cycles will start to get shorter and their bleeding gets a little bit lighter. If there are certain conditions present like fibroids or adenomyosis, that may change and be different. But in general, they get lighter and shorter. And then as a woman approaches menopause, then what starts to happen is she starts missing periods. So she may go 3 or 4 months without a period at all. And that's when you know that you're really starting to get close to the time when they just shut off completely. But that's kind of the progression that we think about as you're approaching menopause and when we're talking about bleeding. Usually lighter, usually somewhat shorter and closer together, and then they start skipping. But this can all be a process that takes place over years.
Right. And did the hot flashes kind of come in at that time as well?
Yes,
certainly. Pretty common. Do you normally recommend doing hormone levels? FSH, LH? I mean, is that something
that's certainly part of the workup at different times, depending on what the patient's coming in for. An FSH, for example, done at a certain time in the cycle can indicate to some degree the amount of reserve that her ovaries have. So a higher number would mean that her ovaries have less functioning left, versus a lower number means they have plenty of reserve or functioning left.
But you really don't need that, though. I mean, you know.
Not always.
Not always. Okay, that's interesting. Joe, question.
Karen Maricopa was diagnosed with chlamydia. Have had same partner for 5 years. I did go tubing. Can you get it from filthy river water? There was a ton of people when we went.
You shouldn't be able to get chlamydia from tubing or from the dirty water. No.
So it is a sexually transmitted disease, basically.
Yeah, it's a sexually transmitted disease. It's probably the second most common to HPV, and it's another one that unfortunately you can have without even having symptoms of it, both for men and women. You might be a carrier and only get symptoms later on. Women who become sexually active, let's say in their late teens, early 20s, chlamydia is something that's very common, but they may get it and not know that they have it. If they're not seeing a physician regularly, or if they don't get tested for it and they have it, it can cause scarring of their tubes and even lead to infertility later on. So that's another reason why it's important for regular visits. But in general, it is something that comes directly from sexual contact.
And that's important. Is there anything that you can get from tubing, for example? You know, if you go out into like a dirty, lake, anything from a female
there are certain things. Women, for example, maybe who take a lot of baths or swim in lakes, something like that, or more can be more disposed to getting something called bacterial vaginosis, which is an alteration in the vaginal bacteria that can cause an odor, an abnormal discharge, or even itching.
Right.
So
that's when we do the KOH stain and we check that out. Okay, very good.
Easy to diagnose and treat usually.
Right, and it is not a sexually transmitted bacteria.
Correct.
Very good.
Linda from Louisiana, for 2 weeks, sex is very painful and burning urination. Not asking for a diagnosis, but what could this be from? 22-year-old female.
It could be a vaginal or a bladder infection would be the most common causes of that. Could also be something, a reaction, if condoms were used and you had a reaction to that, might be also something that could cause that.
And that's important, yeah. So, urinary tract infection is pretty easy to diagnose. So, if you're out there and you're listening and you do have symptoms, don't hesitate to get it checked out because, most of the times it can be treated very simply. It can prevent the sequelae, which is a long-term effect that could, really cause problems down the road.
Absolutely. It could move to the kidneys and cause a kidney infection.
Exactly.
And a lot of times, things that you can do to help prevent getting a bladder infection, increase your fluids, drink water frequently. If you feel the urge to urinate, do so. Don't hold it for long periods of times, but those are just simple things that you can do to help prevent yourself from getting to that spot.
Right. Cranberry juice has been there's some studies looking at the cranberry.
Yeah, or even with the start of symptoms can maybe help those symptoms go away without actually getting to the point of needing antibiotics.
Very good. That's great. Your practice is called Morning Star.
Yeah.
Give me why? What is the significance?
It's a great question. I've been able to integrate my personal faith into my practice. And for me, when I was looking at what specialty I was going to go into, I worked with a couple of doctors who were able to integrate their Catholic faith, their Catholic Christian faith into what they were doing. And I saw how well it matched up with what my skills were and what my interests were. And so as a single Catholic man going into a field that's now predominated by women whose beliefs aren't necessarily my own, I was a little bit wary. So I chose Morning Star because Morning Star is one of the names that we use to honor Mary, the mother of Jesus. And so I wanted to ask for her help and her assistance and guidance in being able to take care of the women that come to me in the practice.
How awesome.
Yeah, and she's taken great care of me through my training and now in practice as well. So that's where the Morning Star comes from.
And you have a wife and a beautiful baby girl.
Yes,
right?
my wife Catherine and our daughter Anna.
Mm-hmm. So
they're the love of my life.
That's awesome. How cool is that? You have another question, Joe?
Janet Rush, North Carolina. I've always been told I could get lots of STDs from public toilets. Is this true? 34-year-old female.
Good question.
Do you hear that one a lot?
We do. That's why I said it's a good question. Mm-hmm.
Yeah. Not that we know of. I think you should always try to use good hygiene. Obviously, if the toilet seat is soiled or not clean or something like that, do your best to clean that off. But I would say no.
I've never seen it. In the close to 20 years that I've been practicing, that's not been something that I've seen. But it's a great question because I think a lot of people think that. And I think hygiene, just in general, we talk about universal precautions. Washing your hands, keeping good hygiene, I think is just important for general health. So that's good. Another question, Joe?
We're caught up.
Okay, good. Dr. Leonard, anything else that you want to kind of talk about as we move forward? Any other topic that kind of rings out?
You were asking about how I got the name of my practice, and just to take things in a little bit different direction. Mm-hmm. Going through medical school, you're taught to leave your faith at the door. Right. You're not supposed to take it into your encounter with a person. But for someone like myself or who's a person of faith, I can't do that.
Yes.
I carry my faith with me, and I try to live as best I can, at every moment. A lot of times I wouldn't be going through that door into the room to encounter the patient if it wasn't for my relationship with Jesus and my desire to serve him by serving the person who's right in front of me. So for patients who come to me, I try to serve them as best I can as if they themselves were Jesus sitting right in front of me with whatever issues or problems they have. Now, I fall short of doing that so often, but that's certainly the goal. Mm-hmm. And when that's my goal, my motivation, I have to carry that with me, no matter where it is. And what that lets me do is to relate to patients on a deeper level. So if somebody's scared about a surgery that they didn't know, they woke up that morning, they didn't know they were going to need a surgery by that time that night.
Right.
And then I'm sitting there telling them, guess what, you have to have this surgery. Mm-hmm. So sometimes I'll ask them, well, are you a praying person? And then maybe offer to say a prayer for them or with them, just to, in that case, bring them some comfort, but also to ask God's assistance, the Lord's assistance for all of those of us who are going to be taking care of that person, because we want everything to go well. And I think it helps provide my patient comfort and confidence in what we're doing. But I think it also just takes a realistic look at the greater picture. And so that's one of the ways that I'm able to do that, which I'm very thankful
that's
been able
huge.
to do that.
As I was telling you just today, I had an opportunity to bring the Eucharist to a patient at the hospital, which I don't have that opportunity often. But I think more and more we're seeing that the physicians have to take that posture of ministering not only to the physical body, but to emotional, spiritual as well. And it's such an awesome. And I think more for you. Because you deal with the gift of life. When you have somebody that's pregnant, that's totally different than me going in and treating high blood pressure. You know what I mean?
Yes.
And I would love to hear, I don't think this conversation, should end without talking about, pro-life and that whole process. And I don't know how you...
Life is a gift, certainly. Mm-hmm. And it is interesting. Obstetrics, it's one thing. Pregnancy is a condition, but it's not a disease. And we want to foster a woman's health. And I often tell my patients, ask them to let me worry about the problems and them to, enjoy their pregnancy and do the best that they can. And I worry about the things that can go wrong, but we certainly don't expect things to go wrong. We expect things to go well. But life is a great gift. Life inside a woman, the vocation of motherhood is a beautiful thing. Women have a great vocation of nurturing life either within them or within their families once a child has been born. And I definitely see my role as helping to foster that vocation and helping them to be good wives and mothers too. But as an obstetrician, I definitely have two patients. I have the patient inside the woman and then the woman herself, and do our best to take care of both of them.
Right. Right. That's great. You have a question, Joe?
Lena from San Francisco, California is 24 years old and her boyfriend is 32. She says, my boyfriend is or was bisexual. We've had AIDS tests and they were all negative. Should I still be concerned about having unprotected sex because of a possible incubation period? Really would like to know this. Thank you.
Sure.
And she said we are monogamous. Sorry.
Yeah. That's a great question. The typical period that we talk about for HIV testing in particular would be 6 months. That if we've tested originally and then we test 6 months later, we think that we will, if there was HIV at the beginning of that testing, that we will find it by the end of 6 months. Is kind of a general rule of thumb.
So that's good. I mean, that's good news. In terms of, there's some recommendations now for prevention of HIV. Do you see that, or do you recommend that at all in your practice?
Haven't seen anything practical that I think will really do that. I do want to go back to something you had mentioned earlier about sexually transmitted diseases and getting them from toilet seats. One of the reasons that sexually transmitted diseases are sexually transmitted is because having sex with another person or having intercourse is something that is so intimate and so personal and so private that it opens you up to these things that aren't accessed any other way. The way the body was designed is to be with only one other person in your life. When you get away from that, you're inviting a host of other problems. We talk about sexually transmitted diseases, but in some sense, that's minor compared to some of the other difficulties that you may encounter. It's interesting the way the woman's body works. When she gives birth, there's a hormone that's called oxytocin. Okay, oxytocin helps her uterus to contract so that the baby's going to be born. The other thing that oxytocin does is it helps her form a really strong bond with her baby. So she sees her baby there holding her, forms a really tight bond with that woman. Well, when's the other time that oxytocin is produced? It's when the woman's having intercourse. Her body's producing oxytocin, which is making her form a really strong bond with this other person. That's the way it's meant to do. That way, when you find that one person, you're married to that one person, it binds you together and keeps you bound together forever. If you're having sex with your boyfriend, your girlfriend, you're forming this bond, but then it's breaking. When it's not the long-term forever bond of a marriage, you're forming bonds and breaking them. And what that does is you do that over and over with time. That damages your heart and makes it harder to form good attachments in the future. So it's long-term damage. It's not just short-term, and it's not just sexually transmitted diseases. It hurts your heart.
Interesting, physiologically, and this is just a question, just listening to you talk, the ability for oxytocin to develop that bond then becomes weakened.
Yes.
So, multiple sexual partners leading up to finally when you do have, a partner and you have a child, would it be reasonable to say then that oxytocin ability to bond even with your child may be impacted?
Yes.
Okay, that's interesting. I've not.
I've not thought of it that way myself either, but that would certainly make sense.
Yeah, that's very, very interesting. Breastfeeding, let's talk about that. I know that physiologically there's a benefit.
Absolutely.
Can you talk about that a little bit?
There's lots of benefits, sure. Talking of bonding, one of the ways that a mother bonds with her child is through breastfeeding and nursing. The American Association of Pediatricians recommends at least a year of breastfeeding your child for the maximum benefit, at least 1 year. And that's something we try to encourage our patients to do, certainly. The benefits go beyond just the bonding with her child. For the child, there are the benefits of good mental and physical development. Studies have shown that children who have breastfed for longer are actually smarter or do better on IQ tests. They certainly have a lower risk of infections, especially like ear infections. You know,
because of the immune.
Because of the immune benefits of the breast milk. Additionally, for the woman herself, the longer that she breastfeeds, it actually reduces her risk of breast cancer later on in her life. So there's definitely benefits both for the baby and for the mother, both.
Interesting. Is there a time, I mean, can you do it too long? I mean, is that possible?
Those constraints are probably more social or cultural.
Right. But physiologically, there's no danger.
Right.
Okay. Very good.
Cynthia Barrow, 19 years old, from the Black Hills. Can I get AIDS or STDs from oral sex? And can I get pregnant from fondling in a hot tub?
Good question.
Certainly, oral sex can be a way of transmitting sexually transmitted diseases. I think more recently, in the last few years, they're starting to see an epidemic of actually throat and neck cancer. And throat and neck cancer can be caused by what we had talked about before, HPV or the human papillomavirus. So certainly any oral genital contact can lead to sexually transmitted diseases. As for fondling within a hot tub, I think it would be hard to see how that could lead to pregnancy, but could certainly lead to other things that would lead to pregnancy. So.
Right. But isolated in and of itself is not a risk, for example.
Right.
Good.
Millie from Tampa, Florida. I am a 31-year-old swinger. Should I be concerned about contracting something when oral sex is performed on me, or is that safe?
That's certainly a risk too, yes. Whether receiving or giving oral sex is certainly a possibility of contracting diseases, again, along with the other risks and dangers that we've already talked about.
Very good. Any other questions? Okay. Do you believe this hour is almost up?
Wow.
Yeah.
It's gone fast.
It really, really has. And we've had some great questions. Again, maybe we have time for another caller or so, but just to kind of wrap it up and pull things together, why don't we just kind of recap, what is NAPRO technology that somebody asked about, the natural planning, and just kind of recap what our conversation was.
We've spoken about a unique approach to women's health. Sometimes it's referred to as NAPRO technology, but it means approaching women's health issues with an eye towards figuring out the underlying causes and then treating those underlying causes as a way to promote the body's normal and natural functioning, as opposed to, for example, just taking a pill which may cover up symptoms or even make the underlying problems worse.
Very good. I think that's probably sums it up. It's a natural approach. There's a question, so let's just kind of, we talked about endometriosis, but there's something called endometritis.
Yeah.
Can you give us just a
Sure.
quick difference?
An endometritis would be referring more to an infection of the lining of the uterus or of the uterus itself. It's certainly more common after delivery, for example. A normal, regular delivery, a week or two later, a woman may have fever and a lot of pain. That would be more like an endometritis.
Okay.
Endometriosis is more of an ongoing condition, something that she might be genetically disposed to, that's going to cause symptoms more around her period. So those are the distinctions. Endometritis is more an infection, something that can be treated with antibiotics usually and will go away, versus endometriosis, which is something like we talked about that takes more in-depth treatment, like a laparoscopy, for example, to alleviate that.
So we don't treat endometriosis with an antibiotic. That's not an infectious process.
We haven't found the antibiotic that would work for that.
Perfect.
Because it's not caused by a bacteria or a virus.
Is there a risk of cancer? Is there a higher risk of somebody with endometriosis to develop endometrial cancer or uterine cancer, or does that put you at risk, for example? Or no?
Not that we commonly think of, no.
Okay, very good. Last question, Joe, before we wrap
And
up.
it's a local. Mary Lou Stoddard from Mesa, Arizona, wanted to say, I really love the show and will be bringing my 15-year-old daughter into you. Love your values and will refer you to all the mothers in our youth group. And thanks, Dr. Borik, for your great service with this show.
Excellent.
Please, could we have your contact information?
Sure, certainly.
Yeah, let's do that now, if we can, and then we'll make sure we post it on. Those of you listening, if you haven't checked out DocTalkRadio.com, we have a website that will have the excerpts of this show and all the shows that we do. But we have a Facebook page as well. So check it out. Come on, like us. We're trying to get as many likes, and maybe Dr. Leonard will really, boost that number up. So that's kind of fun that we do. But why don't you give us your information?
Sure. It's Morning Star Obstetrics and Gynecology. I'm Dr. Clint Leonard. Our phone number is 480-355-8525. You can find us online, www.morningstarobgyn.com. And we're located at Lindsay and Pecos in Gilbert.
Lindsay and Pecos, right. So that's not far from Mercy Gilbert Hospital.
Yeah, pretty close.
Pretty close there. And you do go to the hospitals?
Yeah, we go to both Mercy Gilbert Medical Center and Chandler Regional Medical Center as well.
And we refer there a lot. People listening know that I'm the Chief of Staff of Florence Hospital at Anthem and Gilbert ER. And we don't really have we don't have any OB there. So when we have patients, oftentimes we do refer up the street to Mercy Gilbert and Chandler. So, it's a great community to work in. We're colleagues, and for those of you listening, Dr. Leonard is a fantastic physician, and so I think you've already witnessed that. So, thank you for listening. Anything else, Joe, before we wrap it up?
All right. Thank you very much.
Thank you for
being
here.
With you.
Next week we have Dr. Reddy, who's a gastroenterologist, going to be here, and then we're trying to get a veterinary on the show, and so we have some really great guests upcoming in the next show. So stay tuned, and we'll see you next week.
All right. Thank you.
Great. Thank you. This concludes Doc Talk Radio with Dr. Ann Borik. Till next time, I wish you health, wellness, and many blessings.
DocTalk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.